Hello and welcome to webinar series. Myself Shanti, and today's topic for discussion is about enhanced recovery after surgery. And as the studies have shown that ERAS protocol have been shown to be highly effective in improving patient care outcomes among surgical patients. And as we all know, in India, we practice a WHO surgical safety checklist and to reduce care-related errors. Yeah. So I now request all the speakers in the panel to introduce themselves. So it is my privilege for this, opportunity for you all. Yes, over to Rahim first. Yeah.
Hello, my name is Mrs. Rahimunisa Khan. I'm a MSc nurse and I worked in different post-operative areas. And currently I'm working as a clinical educator in Birmingham, United Kingdom. Thank you, Shanti, for giving me this opportunity. And thank you for Yashoda Group of Hospitals for the privilege to be here.
Yes, so that was a very nice intro, Rahim. Yes, Lishu, can we hear from you? We can't hear you, Lishu. Please unmute yourself.
My name is Lusungo Chilambo. I'm from East Africa, especially Malawi. By professional, I'm a registered nurse and I've been in the field for 20 years, providing the nursing and even the EMS. So I'm working as a head nurse for EMS MASIM. That's a Medical Aid Society of Malawi. Thank you.
And yes, Anuradha, over to you.
Good afternoon, everyone. My name is Anuradha, pursuing BSc Nursing third year in Yashoda Lakshmi College of Nursing at Gowdavalli. I am much thankful to ma'am to having me a wonderful opportunity. Thank you, ma'am.
Yes, thank you, everybody. And we'll learn by, learning. Yes. So this is nothing but a roadmap for the, recovery. Yes. So we would like to understand what is enhanced recovery after surgery. Yes, Rahim. Can we have your insight as to understand what is your practice at your setup? Yes, over to you.
Enhanced recovery after surgery is the personalized care. It's the individualized care provided to every patient so that we can have a safe and organized perioperative care, which includes the preoperative, intraoperative, and postoperative period. Its mainly aim is to reduce the postoperative complications so that we can minimize the hospital stay of the patient and send patients home early. So the complications might be postoperative infections, postoperative pneumonias, atelectasis, or you could see the bleeding and DVT. So we could avoid all those and we can help patient to recover and send home early.
Yes, that was, that actually happens with this pathway and protocol. Yes. Let us see what is the aim of ERAS. Yes, Anuradha, over to you. Anuradha, you would like to say something? Yeah.
Yes, ma'am. The main of the ERAS is that to optimize the recovery of the patient. It even assists and helps that to reduce the hospital stay of the client, as well as it is lessens the adverse events, and it is even improving the patient health condition. It will promote the health and it cures early as possible, ma'am.
Yes. So now over to you, Lusungo. Is a word like we are talking about ERAS? So maybe it may be a confusing, protocol for the viewers who are seeing this webinar. Yes, is a word for ERAS and post-operative period the same? We like to have your insight on the same. Yes, over to you.
Thank you so much. Indeed, somehow it's confusing, but should not confuse people because ERAS and post-op, they are two different words. As ERAS is a comprehensive perioperatively care plan whereby strictly designed for the surgical to reduce surgical stress, optimize physiological function, and accelerate patient recovery, which involves preoperative, intraoperative, and postoperative. While the post-op is just the general care that we give to our clients after surgery. We monitor vital signs, the pain management, and even the wound care. So these are two different words. Thank you.
Yes. So yes, which is very relatively, as you said, pre, intra, peri, and post-operative phases are all included. Yes. Yeah. What types of surgeries can be seen when ERAS, this protocol has been applied to? Yes. What could be the indications? Yes, Anuradha?
Yes, ma'am.
Because, yeah,
ERAS
you
can be
worked
applied
in medical surgical ward. Yes. Over for your insight. Yes.
Yes, ma'am. ERAS can be applied for the following surgeries like TKR surgery, gastrectomy, pancreatic surgery, hysterectomy. In these surgeries, when the patient shifted to the ward, main thing nurses have to follow that early ambulation. Early ambulation is very necessary to prevent from the terrifying complications like DVT, and as well as other complication which affects the patient condition, and even it will stimulate the bowel function as early as possible. It will even decrease the stress response of the patient and their relatives, and it will even manage the pain strategies.
Yes, and thereby patient progress for the faster recovery. Yes, yeah. What are the components like? What are the the components of ERAS? Yes, Rahim. Can we have your few insight by everybody here? Yes.
Okay, as you can see on there on the slide, you can see it involves various areas, but I would like to start with the counseling. The patient counseling is really, really important. It starts from the first outpatient appointment, going to the admission and during the surgery and after the surgery. So the patient should be all their doubts can be cleared, and also we have to address the psychological aspect of the patients. It's not just the physical preparation, what we good at doing it, but address their fear and anxieties, and also the fear and anxieties of the patient family members as well, because that will be a good helps in good outcome. And the second one is optimized nutrition. That's really important because nutrition plays a crucial role in post-operatively in the repair of the tissues, and it helps in immunity building. And so now the trend is we need to start the nutrition as early as possible. As soon as the
Yes.
patient's able to have their first platelets passed, we could start with the fluids and all. And it's really, really important that we play a very crucial role in the
Yes.
nutrition.
As you mentioned, yes, early nutrition is going to promote the wound healing process as well. Yes. So what is your practice at your setup, Lucio? Over to you. How do we
Yeah,
assess
true.
this pain? Yes. How do we assess this pain? Because I think bedside nurses so sometimes they forget to reassess the pain of the surgical clients when they receive. Yes, over to you for your insight.
Yeah, thank you so much. On the pain management here in our settings, we normally encourages as nurses, we need to reassess always,
Yes.
wherever we are going, we need to reassess our patient because the patient can be okay now, but bare after a few minutes, the condition can change. So you can use, you can see the way the impression, facial impression, you can palpate, you can do all means so that you assess the pain in order to give painkillers. You can give physiotherapy or drugs. And then also you can do encourage early mobilization whereby it will help to patient recovery, to recovery so quick and fast, and also to reduce the length of hospital stay, and also to reduce to decrease the health care cost because the patient has totally recovery so quick and fast because of the early
Yes.
mobilization.
Yes. So do we get to ask from the consultant or the surgeon that when should we mobilize the patient? Yes, Anuradha? Do you think we should have this order, then we can inform the physiotherapist, or we try, mobilizing the patient out of the bed? What is your insight? Yeah, and what is your
Yeah.
insight for the rest of the scenario? Yeah.
Thank you so much. Indeed, we need to tell them because it depends with the condition of the patient.
Yes,
Otherwise, if
yes.
we just leave them so that we do the early mobilization, it will increase the post-operative complications.
Yeah, and the major threat is the DVT, P, etc. can be avoided. Yes. Anuradha, do
Yes,
you have
yes.
to say something? Yes. Any insight from your view? Yes. Over to you.
Ma'am, early mobilization is really necessary. Why? Because if we are not following the early mobilization, it might lead to the further complications, as every ma'am had informed just now.
Yes. Yeah. And what other surgical techniques or any effective post-operative care has to be, monitored here? Because hemodynamic stability is very important here. Yes. What
Yes.
is your point on the same? Yes.
Other component is that standardized surgical techniques, ma'am. In standardized surgical techniques, the technology have developed, so we are having number of ways to care the patient. Our doctors are performing the minor invasive procedures, example like laparoscopic procedures. In the picture itself, we can see the robotic surgeries also. And
Yes.
next is that the effective post-operative care. The other hand, the post-operative care indicates that specifically we will provide care after the surgery. Example like wound healing, as well as pain management, etc. ma'am.
Yes, at your setup, and I'm sure at overseas, very well and enhanced advanced technologies are in place where, as you mentioned, robotic surgery, which is nothing but targeted, minimal, keyhole surgeries are in place so that the patient recovers and go home fast. Yes. What are the best practices our nurses should follow in implementing not only ERAS protocol, in any protocol? What should be the compliance requirement? Yes, over to you, Ryan.
I think the first, as I said, it's the patient engagement is really important. So we need to start engaging the patient in the preoperative period, because in the preoperative period, they are more alert and attentive and they could listen to you, and that will help them to follow the post-op instructions very clearly. For example, if I can say, if they're going for cardiothoracic surgery or something, so you need to just explain them how to use the spirometry preoperatively and let them
Yes.
practice a little bit, and then they know what to do, because post-operative they have so many effects with the anesthesia and pain and everything. So proactive patient engagement is really important protocol. And apart from that, we need to adhere to the strict protocols as well, like if in the preoperative, as Shanti has mentioned, that we have a WHO preoperative checklist where we check the patient is being nil by mouth in order to prevent the aspiration during the time of surgery, and we mark the surgical site to say that this is the
Yes.
site the patient is going for surgery. And yeah, we have got all those, and the consent is being taken as well. And intraoperatively, again, in the intraoperative period, the anesthetists, they have their checklist, and the scrub nurses have their checklist to check the swabs and the equipment use, so that everything was done safely. And again, in the post-operative period, every specialty, like if you work in neurosurgery, they have got their own protocols to follow. And if you're working in the cardiothoracic, like CVP monitoring, and in the neurosurgery, they have like intracranial measure monitoring. Apart from that, like we have a protocol, like within the first few hours, we monitor the
Yes.
patient's vital signs very
Are very
meticulously.
important. Yes. So I like to understand from Anuradha, because you are the core bedside nurse. Yes. How would you engage your patient? Let's say a patient comes with major you know uh, we can say like laparoscopic abdominal surgery. So how would you proactively engage your patient if a patient is not in out of anesthesia, or he may take some time, or what addressal you would like to tell to the attender in terms of diet or activities of daily interventions in the room? Yes.
Yes, ma'am. If the I have to engage with the patient means first I will go to the patient and I will see the patient condition and I will try to communicate. We should contemplate the relative and patient what are their doubts, and we have to inquiry. We should verify. I will try to explain in a very brief way so that the patient can understand as easy
Understand.
as possible.
Yes. So this requires effective communication, right,
Yes, ma'am.
Anuradha? Yes. So who are our communicators? Like, who are our stakeholders during this entire process?
Yes, ma'am. As we are nurses, for us, communication is an oxygen. Without communication, we can't survive, because communication is very necessary. With patient, we have to maintain therapeutic communication with the staff, surgeons, anesthetists, physiotherapists, etc. We have to maintain the interprofessional communication even with this facility staff, like class 4 employees and security guards. Each person have been involved. Only the patient care what we are providing is available to the patient as we have planned, and it is even helpful for the curing of the patient as early as possible, ma'am. Communication is very necessary, ma'am.
Yes, very well, valid insight you have provided. Yes,
Thank you,
we
ma'am.
got to communicate. Communication is only the key fundamental, rules for the patient recovery and entire,
Yes,
healthcare professional staff. Yeah. What are the nursing responsibilities? So we have earlier spoken about the components. Yeah. So what are the key role responsibilities? Like how, we should act within the first 24 to 48 hours are going to be very, very important. Yes. Over to you for what you like to say on this, Anuradha.
Ma'am, when I have posted at the medical surgical ward, after the patient came to the ward, we have simply and clearly given the information regarding the fall risk and regarding what are the complications patient might be facing. So always we should go in a way, we should use normal vocabulary so that patient and relatives would understand, which prevents from the stress, and it is even helping us to gain cooperation from them, and it will promote the health of the patient, ma'am.
So are they convinced when you talk to them, or they might again, re-ask, recheck with you? Sometimes they are convinced, sometimes they are not convinced. Why they are not convinced? What gaps we should analyze? Yes. Why they are not convinced sometimes?
Sometimes they might not convince. Why? Because they might feel it might be noxious to themselves, and they might feel that, is this helpful for me, how I can be cured as early as possible. In those cases we should counsel to the patient as well as family members, ma'am, so that they can
Yes.
cooperate with us, ma'am.
Yes, disseminating this information in a very clear, concise, and simple manner is always important. Yes, high quality nursing care also is important. I think
Yes,
yes,
ma'am.
intake output.
Yes,
Yes,
ma'am. Provide. We
yes,
have to, after the patient came after the surgery, we should assess the vital signs. This allows us to know the physiological functions of the patient, so that we can detect, nurses can detect early as possible the infections, any complications might occur. The input output chart is also very necessary for the nurses to rule out the whether the bowel function is happening or not, whether GI system is working or not, as well as the IV fluids are also necessary for the patient to promote the health plan.
yes. Yes, so that was very few, core fundamental nursing care which nobody should forget. Yes, how would we engage the patient? Yes, Rahim, what do you do? Like, patient
Uh,
engagement and patient communication is very important. I think majority of the, grievances or, distressing point from the patient will be sufficed. Yes, over to you, Rahim.
Yes, Shanti, I do agree. Like engaging the patient is really important because if, for example, if you're discharging the patient, so we need to involve them in the discharge process. So it should start like in the very beginning, like during the admission itself, they should know when they're going to be discharged and what they're expecting during the discharge time. And also we need to explain that what are the medications they need to take and what about the follow-ups and everything. And before the
Yes,
discharge, it's really important. But in our settings, we do a multidisciplinary MDT meetings, so that the physiotherapists, the dietitians, we have occupational therapists who will look when the patient go home, how are they going to recover, how are they going to cope with
yes,
their home situation. And it's really important that we plan in advance, and we have a discharge coordinator team. They can be involved, and we involve the community team as well, district nurses, where the patients have to go with big wound dressings. They have to come and change the dressings, or they have to provide the catheter care, and also the handover to the nursing homes, because a majority of our population is an elderly population who are going into the nursing homes. So we need to provide
yes,
the good handover to the nursing homes as well.
yes. Yes, well, that was a very valid discussion. I think time is not going to be enough for ERAS pathway, but yes, we have come to the end of the discussion. Yes, as everybody has provided their insight, this protocol needs a lot of, adherence to the compliance, yes, which will again give a higher patient satisfaction and potentially reduce hospital stay. And every client, they like that they cannot just spend more of the times in the hospital, rather having the early discharge. Yes, I'd like to thank everybody for your valuable contribution. I'd like to thank Rahim. Thanks for your valid time, Rahim, and thanks to Lishu, thanks to Radha. You all have done very well, and in future also we'll try to connect and have more learnings. Yes, thank you.
Uh,
Anybody
Thank
Thank
you,
you.
has any
ma'am.
point to say?
Thank you,
Thank you.
Shanti, for providing this opportunity. It was really a wonderful opportunity to meet international colleagues like Lusanu, and meeting you after a long time. Thank
Yes,
you for the
yes,
opportunity.
yeah. Whenever you visit India, please do, meet me. Yes, Luciango, we will also wait for you. Yes, and all the best to Anuradha as you are going to
Thank
step
you
into
so much,
your,
ma'am,
yeah.
for this opportunity. It's very biggest opportunity for me. I will never forget. Thank you, ma'am.
I'd like to thank all my principal from Yashoda College of Nursing who are mentoring their students in a very, right manner. And
Yes,
then
ma'am.
we can see the outcome by your presentation. Yes, thank you so much. We
Thank
end
you
the
so
discussion
much,
here.
ma'am.
Yes.